I'm a firm believer that God can use anything. God can use anything. God can use anyone. And it's his desire to use us all. So whatever you're going through, God can use that to bring glory to his kingdom and to help someone else along the way. Well, I'm here to share my journey of sarcoidosis. Sounds weird, right? That's how I felt. Sarcoidosis. I was diagnosed over 30 years ago. My journey started around 25. I had severe chest pains. I had severe abdominal cramping when I would eat anything. I mean, it was just irritated. It would not give me rest. The pain would be so horrific. All of the churning and all of the cramping, um, and the vomiting. So many, many, many nights I would end up going to the emergency room for comfort and to try to diagnose what is going on with me at such an early age. Well, they diagnosed me with IBS. They diagnosed me with acid reflux disease. They gave me antibiotics. They gave me injections. They gave me medication, and it would reside just for a brief moment or so. And then I found myself right back going through these same symptoms. And shortly thereafter, it started to affect my eyes. My eyes would get really red and really sensitive to light. It was hard to go outside. It was hard to stay inside with the light on because it was so painful. Little did I know I had sarcoidosis, pulmonary sarcoidosis, which is an autoimmune disease. It has no etiology. It has no cure. It's just something that developed in some of us. And during this time, I decided I was going to be an advocate, be my advocate, and find out what was going on with me. So I would go to different specialists, and they would run tests, and they couldn't diagnose what was going on with me, even with the sincerity of the symptoms. They could not find out what was going on with me. Therefore, I was talking to a friend, and she mentioned something similar that her mom was going through, and she gave me this doctor's name, and I made an appointment to the rheumatologist, and I went over to see him. And just looking at me, he said, "You have sarcoidosis, biopsy and x-rays just to confirm his diagnosis." And he did so. And then he started to treat me, but I needed other specialists. Um, you know, I need other specialists to help me in my care, such as a pulmonologist, and um, I also need an ophthalmologist because of the scar tissues in my eyes, and I need a pulmonologist because of severe scar tissue in my lungs. And so after going to the pulmonologist, I found out that I had 80% um, function in one lung and 20 in the other. So severe shortness of breath is something I live with day to day. And I wanted to share my story because nationwide, I think it's only 200,000 that are actually that have been diagnosed with this disease. However, it is believed that there are many, many more that are undiagnosed. And I just want to share my story, and hopefully by hearing my story, if you're going through similar situations, you would reach out and, do what's necessary to get a diagnosis. But some of the areas, sarcoidosis can affect any organ in your body. And without treatment, it run havoc. It can run havoc through your body to other organs. So the sarcoidosis affect my lungs, such as I just mentioned, my eyes, scar tissue, my skin, rashes and granulosis, weakness in the joints, joint pain. I've developed osteoarthritis from it, night sweats, and severe weakness from time to time, and also depression and anxiety. All of these are symptoms of sarcoidosis. However, it's manageable. There's no cure, but it's manageable. And some of the stressors or triggers to this disease is overexerting yourself. Some of the other triggers are stress. So you have to really find out what you can do to live a productive life, because the sarcoidosis can strip you quality of life. You know, I feel as though I've been sidelined a little bit, but I'm still in the game because I motivate myself, I encourage myself, and I keep it going, and I encourage others. That's my gift. That's what I'm called to do. And I refuse to give up. I refuse to stop. And don't you stop. Continue to move on. God bless you. Please share.